Well, 90% of women between the ages of 18 and 64 have used contraceptives or birth control at some point in their lives. That's according to the Medical Kaiser Family Foundation. But new research this morning reveals some birth control could increase your risk of breast cancer. Joining us this morning with your latest health headlines is our WWL-TV medical correspondent, Dr. Hebert. Thank you so much for being with us.
Yeah, it's a hot morning talking about a lot of stuff.
Oh, we're talking about a lot of stuff. Tell us more about this, though. It could increase your chance for breast cancer.
Yeah, see, now we do know that we've been having data for a long time now talking about, if you use any kind of contraceptive that has the progesterone, or the synthetic progesterone, it can cause you to have an increase in breast cancer. But some of the latest data now is showing that this is a kind of a big increase. Breast cancer increased by about 20 to 30% in this study.
Wow.
Estrogen and progesterone can trigger hormone receptors in cancer cells. We know that. But they looked at the records, and the records of women were under 50 using OCPs. They had an increase in breast cancer risk that was not something just to sneeze at. Now, I don't want everybody going out there saying, oh my God, I've been taking all these birth control pills for so long. What's going to happen? Because there is a risk whenever you take anything that disrupts that cycle to increase your risk of having breast cancer. But the issue is we want you to just be aware. There are a couple of brands out there that if you take these, I want you to talk to your doctor, and that is Camila and also Jolivet. Megace is also another one. So please just check, and I want everyone to be out there doing your self-breast exams, getting your mammograms, catch up on all that stuff, because we know when everybody was worried about COVID, you didn't get that stuff done. So please go get checked, always, always.
Is it odd that it increases your chances of breast cancer, not uterine cancer? Yeah,
well, it's kind of interesting because the way that they did the study, they looked at just the breast cancer variant. And so what happens is that we know that anytime there's an unopposed hormone on a gland, it can cause you to have some increased risk of cancer. So all these things out there disrupting things can also just throw the cycle off. So we want people to be very, very careful out there.
Okay, and then the next headline, cookware and toiletries potentially linked to infertility.
Yes,
this is a big one.
This is a toughie because, okay, now everybody's heard about these forever chemicals, and these forever chemicals, the PFAs, perfluoroalkyls. They sound kind of a hard name to say, but the common cookware, toiletries, and some of the makeup out there contain these forever chemicals, and these chemicals are used to make all this stuff. But the problem is that it's ubiquitous in everything, and so there was a 40% increase in birthing complications if you were really exposed to this, and also a 10% decreased risk in conception. Okay, so what this means is that these non-stick pans out there, all this Teflon, all this stuff, if it's flaking, there have been multiple studies to go back and forth to say this may cause a problem, it may not cause a problem, folks. If you're out there and you're trying to have a baby, I want you to try to look at all your pots and pans, look at all of your things that you use to wash your face and put on makeup, all these things. See if they have these PFAs in there, because these are lifelong chemicals, and you want to decrease your risk. And for the general population, not that big of a deal, but I do want you to look at that if you're trying to have a baby.
No, very interesting.
Yeah.
All right, a plant-based diet may reduce the risk of progression of prostate cancer.
Yeah. Now this is something that, we know a plant-based diet
is good
for everything.
Yeah,
okay? It is decreased amount of meat you're eating, but this prostate cancer patients in this study lowered the progression with plant-based diets at a 52% lower risk in this study. All right, now let's talk about this. They had the 7.4 years follow-up, and these men that ate the plant-based diet. They had a decreased risk of the progression of their cancer. But the issue is if you added 3 hours per week of walking. All right, so it's kind of another little nuance here. At 3.3 hours of walking, then that decreased it by 56%. So what is this telling us, folks? It means that if you eat your fruits and vegetables, if you exercise, then you're going to slow down your progression of any cancer.
Sure.
But definitely prostate cancer. Let's make that happen out there.
All right, interesting stuff as always. Thank you so much, Dr. Hebert.
Thank you.
And of course, Dr. Hebert visits us every Tuesday on the Eyewitness Morning News. If you've missed his previous updates, you can get his expert opinion on our app, YouTube page, and website, WWLTV.com. So check it out.